No, no, that is okay. I will join from the mobile only then.
Yeah.
Yes.
That
Bharti,
is
start.
Yes, madam.
yes, yes.
So, a very good evening to our dear listeners. We are back here again on air on the 293rd episode of Gyan Pravah. And today we have the Iron Lady of Fogsi and one of the Iron Men of academics who will be speaking about the iron. That is, the iron talk beating anemia through all ages, which, in spite of all the technical advances, is still today a problem in our country. To grace the occasion, we have the Iron Lady of Fogsi, Dr. Sunita Tandulwadkar, who has put up an excellent stream of activities during her presidential year. And in that, the Sampurna program focuses on preconceptional care and treating anemias, not only the iron deficiency anemias, but also the hemoglobinopathies. We have the Mukta program, which addresses the screening of thalassemias and genetic counseling for them. So, Dr. Sunita, as usual, does not like herself to be introduced, though she has a stream of awards and achievements. Over to you, Dr. Sunita, madam, to grace the
Bharti,
occasion.
thank you. Thank you, Bharti. 293 episode. Dr. Bellard, it is so difficult to even imagine and think. When we started, I still remember 29 January, the first podcast of ours, and we were thinking ki, how it goes. All credit goes to my fantastic chairpersons. Everyone come out with the fantastic podcast, the faculty, a very great discussion. I'm thankful to them for a great commitment. It was a test which I posted, put them across every day, 8 p.m. So today is the 17th. Every 17th, Bharti will be with some faculty doing a fantastic job. Bharti, thank you so much for
Thank
getting
you, madam.
Dr. Bellard. I always have a huge respect for Dr. Bellard, and I'm sure this program will go very well.
Thank you very
Thank
much,
you.
madam.
And I will join the viewers link to listen to both of you.
Yes, thank
Thank
you.
you, Dr. Bellard, for being
Thank you.
here.
Yes.
Thank you so
Thank-
much, Dr. Sunita, for this opportunity. I know that hopefully this podcast will benefit many of us in this women's health care. Thank you, and thank you for those nice words.
Yes.
Thank you, sir.
Yes. So today we talk about the iron story, which all of us know about, and we have none other than the great teacher of teachers, Dr. Mrutyunjaya B. Bellan. It is an honor to have him here on the Gyan Pravaha. A very brief introduction, because otherwise his introduction will occupy the whole podcast of 1 hour. He is the professor and former head of the department of the Kahir's JNMC Institute, Belgaum, which is a very, very prestigious institute. He has been the president of Kasoga from 2018 to 19, and right now he is the dean of the academic wing of Kasoga, that is the Karnataka College of Obstetrics and Gynecology. Dr. M.B. Bellad had his fellowship way back in 2000 from the University of Illinois, and he has got his FICOG in 2007. He is a global network scholar, a principal investigator for various international trials which are evidence based today. There's the CLIP trial, the preterm labor trial, the cradle trial, clindamycin and rapid iron, kids and neuroimaging trials. He has numerous publications in journals. He's written 2 books and written 18 chapters. He's got, I think, more than 1,000. His resume says 1,000. I'm sure he has more than that talks in regional and international conferences, and he has got numerous orations that he has delivered, which are sought after at most conferences. And he is an expert review member of the ICMR Center of Excellence on Preeclampsia and for many other journals. He's received the Teacher of Teacher Awards in 2022, Best Scientist Award in 2013-14, Best Teacher Award 2010 and 12 from Kahir deemed to be university. He's received the MS Signature Award, and he's got much more. But what I would like to say is he has been honored by the Royal College of Obstetrics and Gynecology, London, and he will be receiving this this fellowship for his academic achievements in the coming few weeks. So over to you, Dr. M.B. Bellat, to speak about the iron story from throughout the ages. Welcome, to our Gyan Pravah.
Yeah, good evening, everyone, and thank you, Bharti, for insistence on me to be there on this. And I am not Iron Man. I want the women to be Iron Ladies because this is where it matters. You all know that the first treatment or the therapy goes in the 17th century, actually, almost 300 years back, where the iron particles were sprayed on some of the liquids, and they were given to see, and iron utensils were used to see that they are not deficient of this. In spite of the all these, it has not been very successful. Though in 1964, the Boers Committee recommended, and in the late 1960s, India that started the anemia treatment program, and especially in pregnancy. Because if you look at globally, in spite of these 6 decades, 5 to 6 decades of its use, you see the NFHS data that more than 52% of the pregnant women, and at all ages, be it the children, there is a 67%. That is, two-thirds of the children under the age of 5, they are anemic. Adolescents are anemic. Adults are anemic. Pregnant women are anemic. So you can imagine, see that this is a vicious cycle. What in our developing world happening is a woman who is pregnant anemic, iron deficient, gives birth to the baby which is not with well stored iron. You all remember we were told that even mother is anemic, baby doesn't suffer anything.
Yeah,
It's
that was what we were told earlier.
wrong notion. Correct.
Yes.
So
Yes.
this is where the importance is this vicious cycle: baby born with anemia, child with anemia or infant with anemia, adolescent with anemia, adult with anemia, again she becomes a pregnant, and this vicious
Yes.
circle goes on. So somewhere we need to break this, that you agree with me that we
Definitely.
want this to be broken. This vicious cycle needs to be broken. And
Broken.
there are other factors, of course, for the anemia, but this is the main important factor we are suffering. And further, they are all increased by the excessive bleeding, puberty, the menorrhagias, adolescent menorrhagias, and adult menorrhagia. See, women usually compared to man. Why women is more anemic is the man doesn't lose blood periodically, like every month with the
Yes.
menstruation.
And
But unfortunately, women are troubled with the 3 important factors: the
menstrual
pregnancy,
cycle.
the second is delivery pain, and the third one is every month menstrual cycle.
The menstrual.
I just want to bring
So
some issues before I go ahead on this is in our school programs, the most important message that goes in the developed and other world is that in the school, all the boys are taught why they should respect the woman,
women.
girl, and the mother. The reason being, all this is being explained. I want to tell one important message that my cousin who was in Nottingham some time back, her kid was about third or second standard, and then when he came back from the school, he hugged her mother, so that mom, so much dedication for us because you have monthly bleeding, monthly suffering, pregnancy of 9 months, labor pain, and this all is so much troublesome, and they bring us to this world as well as they make us grow. So you are such a great person because on that day in the class, they were
Yes.
taught respect the woman
Woman.
because they undergo all this. Additionally, we should not trouble them. This message stuck into him. I think you are doing
Excellent.
a lot of work
Yes.
on adolescent and school health program. This must be one class in all boys
Yes.
schools. This is the
I
message
think
I want to
I
give.
think this is a very wonderful thing. Like as you said, if we speak to the children when they are young about what trouble the woman has, I think the way they look at the mother, they look at their sisters, and they look at women outside also, the whole perspective will change. And as you said, we always say Matru Devo Bhava in Kannada or in Sanskrit also. But the actual meaning, I think they need to explain to these children, because they say God made mothers because he couldn't be everywhere. And mother
Exactly.
is, and as you said, the mother is also very, very responsible in seeing that her child does not have anemia. So, on
Correct.
that aspect, as you said, she has to start eating from when she is an adolescent, iron rich food, so that
Yes, yes. I
hemoglobin,
don't want it to be adolescent. Before that only.
even before that, we have to
Yeah.
speak to them. Yeah. So, in this perspective, Dr. Bella, you already said that yes, anemia, this vicious cycle has to be broken. So, in that way, what do you think? Like, in spite of all the advances today, we are seeing 60 to 55 to 60% percentage of children as well as adolescents who are entering parenthood are anemic. So, what would you cite as the most common reasons for these? Because even in the we were not, I mean, even the upper income groups, we are not seeing anemia in the poverty ridden population. We are seeing in the middle class and upper middle class also. So, what do you think are the reasons for this?
See, the question basically comes is the absorption, the iron absorption and type of food and the type of food change which has happened compared to what in the olden tradition. They used to eat iron rich diet along with the protein. To give an example is when I was a child, the routine practice is to have peanut with jaggery.
Yes,
And
yes.
jaggery was really prepared without chemicals those days.
That was the
And it was,
snack for us in the evening. No
yeah,
chocolates.
yes, like a
We had no
chocolate.
chocolates.
There were no chocolates. We were never exposed to any chocolate. And not only that, there were no phytates.
Yeah,
Till I grew as till say my 10th grade, I never drank a tea in my life.
true. We were
Only
not
after
given.
I,
We
no,
were
no,
never given coffee and tea.
yeah, they were given milk. We were
Yes.
given milk. So first is food habits and the phytate, that the frequency of what junk food we are eating. But the important reason for our persistence of anemia is nutritional aspect is number one,
One.
and the type of food we eat. And importantly, when we are treating these people, we do not have the concept of how the iron gets absorbed.
Absorbed.
Even the richest food, only 10% gets absorbed. And if we are having phytates, like, I mean, the factors which are affecting its absorption, like tea, coffee, and after food, these are the factors, and co-administration of calcium or others,
Along
they
with
all reduce the iron absorption. And the required iron, we want first baby to be born with the full
iron
iron and
stores.
all the
Iron
other.
stores.
So I just want to give you this information we have given in our publication. 1 gram of IV iron also when we gave at early second trimester, even this did not cover the required storage or the cord blood when we checked. Most of these babies, even after giving 1 gram iron
IV
orally
iron.
IV, they were still
Still
deficient in the cord
lacking.
blood, because 80 picogram or whatever the dosage in the cord blood was never met in them. So you
Okay.
can imagine with the oral iron, where is the
Yes,
situation?
exactly. What impact will it have?
Yeah. So I just want to convey that we should see that pregnant woman enters a pregnancy with a good iron stores
Yeah,
and supplement during pregnancy and later in pregnancy also, because that is the one which goes to the storage, because breast milk hardly has got
has
iron.
any iron in it. Yes.
So that is the message I just want to give is pre-conceptionally, we should see that woman is healthy, because
Yes.
there are other factors also like hypothyroidism, diabetes, these all affect. You were asking why the affluent class also. There is a high diabetic population in pregnancy. And what happens, the diabetic babies, pregnant women with diabetes, the iron gets diverted into other. Instead of going to the brain, it goes into this polycythemia, which is found in this diabetic babies.
Diabetics.
So you can understand that their requirement is
Yeah.
well, and that diabetic control is also very essential. So iron is one aspect. We need to look at the other aspects
The
also.
micronutrients also have
Yes,
to be addressed in that.
addressed.
For
And plus
proper iron utilization, we need the micronutrients.
vitamin B12, folic
Yes.
acid. These are the other things we should be addressing. Apart from that, Bharti, now there is a migration of population. The
Oh, yes.
hemoglobinopathies have not restricted to only the endemic areas.
Endemic areas.
So we just concluded in our study with more than 300 plus pregnant women. Almost 9% of them are having the hemoglobinopathy.
Hemoglobinopathy. Though
So I
the
just
statistics say it's only 3% or 3.5, so you know that there's inbreeding and there is a transmission to much higher levels. So
yeah.
while we are focusing on iron therapy, we should keep it at the back of the mind that hemoglobinopathies are also lurking around us. So as you rightly said, Dr. Beller, the supplementation of iron is happening, but I think somewhere we are missing this, what you said, mixing it with food and phytates. So
No,
I
not
think,
only that,
Hmm.
the way we give the iron all along, we are
Yes.
giving two times daily, every day. You think it will get
It
absorbed?
will not get
No,
absorbed, yes.
because since 1998 only,
This
the
has been introduced.
hepcidin has come into picture.
Yeah.
But unfortunately, it was not given. Maybe the reason I don't know whether there was a drug company's influence or which influence we had. Because if you give everyday iron, I don't think it will get absorbed.
Yes, because of the hepcidin cycle
Yes.
metabolism, it doesn't get absorbed. So I think
Absorbed.
probably we need, and you have done excellent studies on this, we know that. So before we talk about the academic part of it, there are a lot of awareness, as you said, when we go to schools, when we go to colleges, or we go to any association, I think anywhere we can spread awareness. Like today being the World Prematurity Day, we did go and speak to a lot of mothers about the preconceptional care. So I think this is one step if all of us adopt, and Dr. Sunita and Fogsi also has taken this up in the Sampurna program, that we have to see that before a girl or a couple, I would say, enters this parenthood, that passport of theirs should have preconceptional care, where, as you said, their hemoglobin, it is not just the hemoglobin, I would say stress here, because you repeatedly have been telling us that just checking the hemoglobin is not sufficient. Their iron stores will be depleted, and when they enter parenthood, their hemoglobin may be lurking around 10.5, or and we say, oh, it's only 10, it's okay, 10.5, 11. We need to understand that the iron stores are not assessed most often. So could you please tell us why this is very important, that we need to assess the iron stores whenever we are treating somebody for preconceptional care or even for anemia?
See, basically, iron is required for every cell metabolism. See, be it a muscle, be it a myometrium, be it a endometrium, or any cell maturing cells, even bone marrow
The
function,
neuroglial tissue also for
and the
neurodevelopment.
neuronal activity.
Development.
Because the cytochrome oxidase is present in all the cells, any good metabolic activity, iron that acts as a catalyst there.
Yes.
That's one component. But the blood oxygenation. See, when we say that Bhartiya is functioning very well, there is the oxygen is
Good
given in
oxygenation,
food
yes.
and other system. Unless we have a good hemoglobin, and that is supplying the oxygen to all the tissues, the function of each system optimally requires this iron. And every system is involved is associated with iron. So my concern is, if the woman is having sufficient stores, I just want to tell you that if your parents, parents, every day evening they complain to you, ಕನ್ನಡದಾಗ ಹೇಳಬೇಕು ಅಂದ್ರೆ ಕೈಕಾಲು ಹರಿತಾ ಇದಾವೆ ನಾನು ಸಾಯಂಕಾಲ, and I am having a pain, and even younger girls and others,
Backache,
no,
yeah,
no, more than that is restlessness
cramps.
syndrome. That's what is said is their thigh muscles and calf muscles are affected with this.
Okay.
And there are more than 40 to 50 symptoms associated with anemia, and preferably with iron deficiency. So I just want to ensure that any symptom, if you first look at, there are many, many symptoms. I have time, even the restlessness, irritability, the what you can, that is, clouding, you can brain
Mental fog,
brain
mental
fogging,
fog,
brain
brain fogging.
fogging, and loss of memory, poor memory, all these are associated with that.
Associated with, yeah. And yes, I think Dr. Bella, you put that across very well. And here I would like to say that when we are speaking about anemia, we are generally talking about anemia in women, but we are forgetting our very male counterparts, because I'm sure there is a lot of anemia in men also. We
Yeah,
cannot
yeah.
say
I just
yes.
want to give you that, NFHS data says that there is a increase in the incidence of men. Anemia has
Yes,
increased.
I want you to speak about that.
See, mainly because most of the alcoholism has gone up in men. And that whatever it is, alcohol prevents absorption of water.
Absorption.
And they actually, alcohol in a small quantity increases appetite, and it helps. They should eat at that time good food. Unfortunately, most of the alcoholics in a lower class or higher class, they drink,
Do not eat.
and at the end they do not eat. And what is required there is a good healthy diet is required with that. So
Yes.
unfortunately it is not. And alcoholism has become rampant in villages.
Yes,
When
very
I
true.
was in my village, when
There
during
was nobody taking, there was no
the
alcohol in the village.
alcohol shops were one, that too they used to go hiding and
Yes.
eating them. Unlike today they are open. In the evening there will be queue. They earn money. Most of that goes in the alcohol.
Yes.
And combined with good food, after this can change, but unfortunately they
They do
spend
not
lot of
consume.
that is the main reason. And of course we still hamper or they harbor these men, the the elements,
Elements, yeah.
worms,
Barefoot working, yeah.
and that should be there.
Yeah.
Another factor which affects men, plus the stress factor reduces the oxygenation, and if they are anemic, iron absorption is not happening from the gut.
And they also, their alcohol along with smoking and all those things.
Yeah, smoking also blood supply is reduced to
Yes, it prevents the absorption as well as the gastric impairment, and again iron absorption is not there. So I think
vasoconstriction happens.
yes. So we have been always talking, because of course, though anemia, the impact of anemia in women is more implication on the future generation, and we are talking about nurturing the future now. So we are always, yes, the government of India has got the scheme of supplementing oral iron, but I think that is, as you already have been telling us, this oral iron, though we have been given for numerous years, we know that it is not being an impact. So now I think each one of us as OBGYNs have to be speaking more about intravenous iron, and you have the credit of doing excellent studies and presenting them with evidence on the use of IV iron rather than oral iron. I would like you to tell us about your study, the inference, and how we need to take this into our practice.
See, unfortunately, I just want to share there our the ethical guidelines, permitted, because we had to use in those non-responders also oral iron, or we had to use IV, because hemoglobin, if it is not risen more than 1 gram in 2 months, we had to give them IV iron. And when they're non-responders like this, and for rescue therapy, woman whose hemoglobin was at less than 7, we were at 28 weeks, we had to give them IV iron. So that, the final effect was not there, because we were looking at the 30 to 34 weeks or pre-delivery hemoglobin with oral and IV. But one point which tells very clearly is the non-responders were higher in oral iron. And unfortunately, we used in our study moderate anemia, which was 7 to 9.9. See there, once you give 1 gram IV iron, only it is meeting the storage coverage.
Yes.
The requirement of pregnancy was still deficient. So my point on this study has come up because we used this, it is done in 2 states with three districts of Karnataka, Belgaum, Raichur, and Bagalkot. They were C category districts, Bagalkot and Raichur. Belgaum was a B category, and Jaipur district in Rajasthan. Because we have around 46%, 45.7, Rajasthan and Karnataka has anemia. So we diagnosed iron deficiency by all the investigations. and we had 3 arm trial, 2 IV iron preparations. In India, only 2 single-dose IV iron preparations
Available.
are available,
Are available.
compared to USA, where they have 4 low molecular heparin, low molecular dextran, and fermoxetol are the 2 other single-dose IV iron preparations which are available. But in India, ferric carboxymaltose and iron isomaltoside or ferric derisomaltose. So in our study, it proved beyond doubt that ferric carboxymaltose was superior to iron isomaltoside in bringing the non-anemic state as well as the low birth weight compared to the other IV iron. Plus, the side effects were more in ferric derisomaltose than ferric carboxymaltose. So, what happens is we are also looking at the babies, how it neuronal functioning and other things up to 3 years we are looking, and also brain structural development also we are
Neurodevelopment.
neuroimaging. By we have done this is the first of its kind study in the world where the IV iron versus oral iron. We are doing the pregnant woman MRI of the fetal brain development at 34 to 36 weeks, then at 4 months of the baby when after birth, 12 months and 24 months. We have completed.
Interesting. Oh, that's a very interesting thing. Yes.
So we are going to look at the data now, and we are shortly going to publish both these studies, kids trial, the neurodevelopmental cognitive changes in the babies, which are going to be seen. So this is what we have found is the low birth weight is lesser in IV group compared to even when you give oral IV iron in the early pregnancy compared to oral iron. But
So
most important point I want to tell you is the important impact what IV iron can bring change is you are supplementing this, and woman is not anemic, her APH will be less, her preeclampsia will be less if you give preconceptionally, and most importantly, I mentioned in Hassan conference also that postpartum hemorrhage will be lesser in non-anemic woman. That I gave you 5 reasons for all these. How anemia causes PPH.
Yes, that's because as you already said, iron is required for the myometrium. Iron is required in the
and RBC rich flow. If it is anemia, it disrupts the lamellar flow, and the viscosity is less. It fast bleed, and there is a cardiac rate, heart rate, and the blood pressure flow will be increased because of the chemoreceptors and all.
So that vicious cycle is there. So I think all the listeners here need to understand that it is not that we're giving iron or just for the anemia component. It is a comprehensive treatment which is going to bring down all the common morbidities we are having in pregnancy. For example, as you said, the small for gestation is the prematurity. Though prematurity, there are various reasons. I think anemia is one of the root causes which can diversify and present in many other forms like hypertensive disorders of pregnancy, infections, or even a cervical incompetence could be a component of a poor myometrial structure or cervical structure because of the chronic anemias. So I think that is why I said we have to always talk about iron. And here I want to present, when you were telling me that neurodevelopmental studies you're doing, I think that's a very interesting study because as these pregnant mothers and the family come to us, whenever we talk about the baby's health, they accept whatever we give them. They are compliant when we tell them. For example, it may be hypothyroidism or anemia. If we tell them that preconceptionally, if you correct this and you become pregnant, or during pregnancy you take your medicines correctly, your baby's brain development is going to be good. I think that one mantra works wonders for them.
Yeah, this is what we have used. I just want to tell you, the anchor or the supporter for neuroimaging was one of the physiotherapy principal madams. When she was pregnant, we gave her IV iron, and then he said that we want to do the study to impress. See that they accept this MRI of the brain for the baby's brain. So we used her as a person and just to project for the other woman that she being a principal permitted her, and she other day she came, doctor, what treatment you have given? my kid is so
very smart.
Questions they ask. Maybe I don't know, the one factor could be that,
maybe
but But she was such an influential person.
Yes.
Many of our institute people come to our institute for this, that IVRN you give me for during pregnancy. That message, more than that, during pregnancy, my contention is to treat preconceptionally.
Very true. Yes, preconceptional care is what is of utmost importance. And just taking this forward in what you quoted, one of your the principle. As my practice goes on in Hassan for the past 30 years, delivered many babies. So whenever I go to some Children's Day function or to some other function, there are a lot of these small children whom we have delivered who are on stage, and so many of parents come to me and say, "My son is dancing, my daughter is dancing." They'll say, "Idu yar kainal, who delivered this baby?" Of course, Dr. Bharti. That is why the baby is so smart. So I'll say it is not Dr. Bharti who's there. Yes, I have given you good preconceptional care, antenatal care, and intrapartum care, and you have followed my advice. That is the reason your child is so smart today. I think that gives us a very good feeling when we
Correct.
see that those children are doing so well today. Probably that preconceptional care and talking about nutrition is very important. And one point you made very clear about how the iron is taken. We need to spend just about 20 to 30 seconds and put a small line on our prescription. Take your iron capsules, if you're on oral iron, in between meals. Don't take it with coffee, milk, or tea. Take it with a glass of lime juice. This is what tagline I write on all my prescriptions and tell them. I
Yeah,
think
that is the message what I give is
yes,
the time you should mention. If you
yes,
are having lunch at 1 or 2 o'clock, 2 to 3 hours after that,
mid
you
meal.
take at 4 to 5 o'clock, you take this tablet.
Yes.
And if you love the lime juice, you
Take it.
take with
Yeah,
that.
if you're diabetic, don't take the lime juice. Just take
Yeah,
it with plain water.
just only they can eat after some, lemon, they can chew also.
Yes, yes. So this is, I think, where we practitioners have to follow, because very often they will say, "No, I'm taking the iron capsules, doctor. You're saying my hemoglobin has not come up." These small practice points can make a lot of difference. And spending time or making your assistant talk about or just keep a picture and tell them what is nutrition, what is available regionally. We have a lot of green leafy vegetables in our country. We have papaya. We have fruits like pomegranate, which is grown rampantly in our part of the country today. So, and jaggery, as you said, we have jaggery today, especially the darker version of the jaggery. These small things, I think, in nutrition we have to tell. So now we are talking about iron throughout ages. So, of course, we have focused on the adolescents and the reproductive age group. Now, of course, women also think that once I have delivered 2 children, my life is set. That's all. I have proven to the world that I'm a very successful woman. But unfortunately, today, women in the midlife who are the anchors of the family, we are seeing are suffering silently because of this chronic anemia. I would like you to address these issues.
Yeah, see, it's very important, I tell this, they should concentrate on this, menstruation.
Yes.
Because nowadays what is happening also, I tell you, earlier woman, they used to deliver 5, 6, 8, 10. But today's woman, they want only 1 or 2. I think that is the one factor, which promotes the fibroids and
Fibroids, yeah.
also heavy menstrual bleeding. And the woman neglects that, even however many
Yes.
times it happens, unless it comes to their neck, that means they have some symptoms, they don't even inform their husbands. And I bring them and I give a message to their husbands. Please place your palm of the hand next to your wife's palm, and not to see that palmistry purpose or
lines.
it is
Not the lines, see the color.
it is the color. She also should look pink, like how you are. When most of the men are not anemic.
Yes, they are not anemic.
So at least, place them too. And I show this even in my antenatal care and the gynec patient when they come. I never directly do a hysterectomy cases when there is indication. I have last 8 years, I have 8 or 10 years, 2012 onwards, 13 came FCM. I have not given a single blood transfusion to do or a planned hysterectomy. I
Same
give
here.
progesterone to see that the bleeding is not there, and give the IV iron, bring our own hemoglobin more, and then do that. Today only I had
Safe
a
practice.
big 32-week size fibroid has come to me. She wants myomectomy. Though she's married 15 years, she wants to have kid. She has no kids. So there is a big 12 into 15 centimeter fibroid. I told her that first I'm going to treat with IV iron. Let your hemoglobin be good, and then we plan. So the message I want to give is, see, this anemia, they silently suffer. They
Yes.
have a leg pains. They have a, irritability. They start, small noise made by our grandchildren.
It's
All
not
those
just the physical health, their mental health also
health.
suffers
Yes,
a lot.
yes, yes.
So
They
eventually social health suffers.
and family members also suffer because of this
True.
irritability, and
Irritability.
added by menopausal symptoms at this
Yes.
stage, they all add on to this. And woman is a pillar of the family, central pillar on
Yes.
which everything lies. Today,
Yes.
if my wife is ill, whole home is under the
Is in chaos.
yeah.
Chaos.
Yeah. So she is the main person of the family, and I really want to share with you the talk which was given by Dr. Edgar at FIGO conference,
Okay.
where the emperor is naked. Emperor
Okay.
is naked.
Huh.
There he has said the woman, because he mentioned, nowadays parents want to have only one kid, two kid. In Japan, some schools are getting closed because
Yes.
there are no students.
Schools and hospitals in Japan and Korea. Even
Korea.
obstetricians are jobless in Korea now.
Yeah,
Who wants to
because they
become an
don't want to
obstetrician?
have more than one kid. He
Mhm.
mentioned very clearly, men, please awake. Your
Get up.
participation in health helps your wife or woman to have subsequent pregnancy, another child. We need children.
We need
So
children.
this message, I have spoken to him. I am trying to get him on one of the webinars, and
Excellent.
what he addressed to that. So it was amazing to see that we being a men, we are, unfortunately, when during our childhood we were taught, don't go to kitchen, don't do this, this is not your
Yeah,
job. And
don't share responsibilities.
yes, this type of work is not yours.
Mm.
So unfortunately, there should be sharing of the work in the home. We should be part of our women's work, and then see that they are comfortable, say they can be able to take care of this. And all the irritability, men, please concentrate on your better off to be comfortable yourself. This is
Yes.
my message I want to give.
Yeah.
Because if they are anemic, they are irritable, if they are hypothyroid, they are
The whole
menopausal.
atmosphere of the house is
So
not
I want
congenial.
one message to give is, men, please share the work of the women at home, and they will be also helpful for you and other things.
Yeah,
This is
and
a
along
message.
with this, I would like to say that, see, as you said, in the patriarchal society, it was always the men would eat first, the men and the children would eat
Oh,
first.
that's not
And
the thing which
that should
nowadays.
not be there today. You should all sit to the woman also should sit together with the family, sit at that time and eat together, and the men should see that his wife also gets equal share of vegetables and fruits, and they all share whatever they have. I think that
And
also should be
that
there.
discrimination of male and female should not be there.
Yes,
They
in,
should eat together. You come
together.
to know who is eating what.
Yes, children,
And another
parents,
message I want to give for a woman is, you drink more water.
water.
Woman and water are opposite to each other, because and that causes urinary
Yes.
infections. Chronic urinary infection is another
Again,
cause for
another
anemia.
cause of anemia. Yeah, that is because, of course, they have their inhibitions that they cannot void in public, or they can't travel. So that is the reason, I think, as you said. So in this perspective, when we are talking about midlife, I would not say menopausal, midlife women who are living longer now. Lifespan has increased almost another 30-35 years. They are living from the age of 40 to
Menopause.
75 or 80 years, and they need to have their annual checkups. They should not say that their uterus is there only for having children, and that's done with it, and my bleeding is normal. When my periods are going to stop, I'm going to have excess bleeding. These myths, that is the responsibility of our healthcare personnel to speak wherever we get the opportunity, to say menstrual cycle should be only these many days. If there is something abnormal, you have to come to the doctor. Every year, like you celebrate your birthday or your festival, please come to the hospital once a year. Get your breasts checked up, get your uterus checked up, and your hemoglobin checked.
I want to give two things in life, be message, because at least by what this, if it is implemented,
Hmm.
probably we will prevent
We can help.
important things. One is marriage registration when it is happening. there the health checkup should happen, and iron thyroid should be checked with
They
it,
checked.
correct them there itself and suggestion, then their marriage is registered. That is one message. Secondly, insurance, we are all having health insurance now.
Yes.
In Ayushman or in private health insurance, the cervical smear and annual the breast
Checkup has to be
examination,
mandatory.
and the pelvic ultrasonography at least should be made compulsory for
Mandatory, yes.
women, so that they want their next year premium to be paid, they have to give this.
Get
You
these
think
tests.
government, the US has not come to the prevention of cervical cancer just like that?
Yes,
They must
they have it mandatory.
produce the pap smear report if they want the insurance premium to
They will
remain.
not get it otherwise. They will not be given the
Otherwise,
insurance.
no, their premium goes up. So they struggle to do this. So these three important messages should go to prevent anemia and other related complications, because these malignancies also cause heavy bleeding,
Yes.
and they are also associated with that.
So as you very rightly said, Dr. Bella, I think in Fogsi, we need to take up these two things. I've also been thinking on these very, very commonly. And I also had another idea, like when we go for a wedding, this is what I'm going to do in the next few days, few months I'm planning, that we go to weddings, we go to numerous weddings, we give them a gift or we give them whatever, some sort of a token of gesture we give. So I thought we should make a small handout when they come and give it to them and distribute those in these wedding houses and give it to the boy and girl about preconceptional care and contraception. Give them a small note when we go and wish them. I think if all of us do such things, this is where how we can create awareness on a large scale. And Foxy, I think, can definitely look into this, getting these tests done at the marriage registry. We can very easily ask an NGO or any one of our associations could set up a cell there where somebody goes and does the hemoglobin and thyroid test for both of them. And insurance companies, as you said, many of the Western countries have made it mandatory. I think we should also suggest to them, because very often they'd only see that have you got any hemoglobin, have you got hypertension, diabetes, is only two things they ask in an insurance policy. They never, are your eyes all right, can you drive? They never ask these things. I think these are two very good points that we definitely need to take home, to see that we can somehow screen our women and see that they do not have communicable as well as non-communicable diseases. And in that
one point, Bharti, see how we have come to know that there are births and MMR we are able to calculate.
Yes, data.
That is because death registration and birth
Compulsory.
registration, live birth is compulsory.
Compulsory.
That is why, see, it's such a tragic thing is still we are unable to catch all the births.
Yes.
All the births, because we are only
Miss
having
out.
live birth information because of the corporation registry or the panchayat registry. So important message is those births with stillborn
Those
and
also should be
others,
reported.
they are not being reported. And our maternal mortality, that's why we are still saying ratio. Ours is not a rate, MMR ratio it is.
Okay.
Not like in Europe and USA, it is a
Rate.
MMR rate. So what we want is marriage registration. Why I'm suggesting this is marriage registration is compulsory now. At that time, preconceptional care must be implemented.
Yes,
And
yes.
unless they get those reports and the treatment report, they
Don't
should not
register.
be registered. Number one. And secondly, as you suggested, you can tell them during the wedding. More than that, शादी हो रहे है, TV में advertisement भी आना चाहिए. It should come in the wedding. You
Yes,
know, the
yes.
advertisement.
Promotions.
TV promotion should happen on this. So because unless we prevent anemia, our children are going to be unhealthy, anemic. So
And
you
we are already
want
seeing
to
the
bring,
impact.
we want to bring this change.
We are seeing that impact because we are seeing the high incidence of hypothyroidism today, obesity, diabetes, hypertension. I think these are all related to anemia and the intergenerational transfer which is occurring in the unborn fetus. To be born fetus, we know about the Barker's hypothesis, and anemic women are bringing forward sick progeny. So that is, I think, the reason we need to attack it there.
Correct. Absolutely, it is required. At every level, we should prevent anemia.
Anemia.
That is, whether be it a child, be it a pregnant woman, be it a baby, it has to be. Even, just want to share, being my wife being a pediatrician. She did a small study on these, babies supplemented with the newer oral iron, that is sucrosomal iron.
Okay.
Amongst the currently, there are different iron preparations, but there are sucrosomal or liposomal irons which have come up in a big way, and they are recommended in alternate or twice a week regimen, which is equivalent to the other regimen which are being practiced. So my humble request is, if there is no urgency, unlike a pregnancy, because pregnancy is 280 days fixed, first 3 months we cannot give. So 180 days oral iron cannot meet the demand of 1,000 milligrams.
Yes.
It is when the woman is not anemic. But if the woman is anemic, 1,000 plus this her anemia correction needs and storage correction. So it cannot meet with the oral iron. So that is the reason we are promoting that they should be iron sufficient during entering that the pregnancy, and even you can give the supplements, wherein if she is not store deficient, there you can give twice a week or one alternate day oral iron.
Yeah. So yes, I always commend this point because I do follow that practice. And here I want to say is our healthcare obstetricians and gynecologists, though the Fogsi, the Kasoga, we have all done a lot of work in trying to get intravenous iron into the government protocol and available in most of the public sector hospitals. We are seeing a lot of hesitancy, not among the women, but a lot of hesitancy among the obstetricians and gynecologists in administering IV iron. I want you to stress on this and tell them, give us the safety features and how we can give them oral in intravenous iron in a very small setting under very safe protocols. Dr. Bellad will be joining us. So to continue on, intravenous iron, there is a lot of evidence and various studies to tell us that intravenous iron is safe provided we follow the protocols. Intravenous iron is very efficient, and it is very, very important that it raises the hemoglobin levels very rapidly so that we have an iron-free, anemia-free woman who can carry on her pregnancy, or even in a non-pregnant lady when she's undergoing a surgery or she's come for anemia due to menstrual disturbances, we can correct this with intravenous iron. So we have had Dr. Bellad, who has given us a wonderful input into the management of anemia through the ages and how important the management of detection of anemia and lifestyle modifications like nutrition and dietary habits have to change, and the use of oral iron as well as more frequent use of intravenous iron can definitely go a long way in preventing anemia across the ages. So I would request Dr. Bellad to kindly give us the concluding remarks as we are coming to the almost to the end of the podcast, which is a very, very fruitful one. So I was just during the technical error, I was talking about the hesitancy of intravenous iron administration among our own healthcare personnel. So we have trained our nurses, though in the private, we have trained them. We have the checklist and we have the SOPs to administer oral IV iron. And we have
Bharti, before you say that, there is a method to give IV iron. We have a video of this. I don't mind sharing in any forum.
Yes,
we do not have any selfishness on this because our women should get IV iron in a safer way. So that message should go. And please, even though you may be a skilled person, don't take IV iron at home.
Yes, true.
Because you have seen some of the
untoward incidents have occurred.
People, they have trying to take at home, and any drug when we give intravenous, it can cause reaction. So iron is no exception. In 3,000 infusions we did in our study, we had one anaphylaxis, and that was managed at the drugs which were kept given at the CHC itself. So we need to keep emergency drugs, emergency facilities. There should be proper supervisor. These must be given in an optimum time, not middle of the night or very early morning when nobody is there.
Nobody is available.
So it should be done in a proper way, and keep these infusion rooms if it is possible in your place. and that with all these equipments. I will share that video with you, and I
Yes.
have sent this to Dr. Bhaskar Pal, also next president, who is taking up, because he asked me, he is conducting CMEs in many places.
Next year,
So I
yes.
have shared the anemia presentation as well as the video on postpartum how to give, antenatally how to give. It is very clearly mentioned.
Yeah.
So, and as a healthcare personnel, please, when you are able to manage any reaction, and most importantly, initially when you start, there will be little tightness in the chest or difficulty in the neck. So this is called as fishbone reactions.
Okay.
Just stop for few minutes. They subside on their own, and then you can give. And I just want to give that whenever you are giving IV iron, these are the important drugs. Please keep them with you. One, anaphylaxis is adrenaline. Number two is
Hydrocortisone.
methylprednisolone, hydrocortisone, injection Avil. Though it is a non-mast cell mediated reaction, but still our doctors want to give Avil. And last but not the least, H2 antagonist injection, ranitidine or famotidine,
Pantoprazole.
which is they should be kept in place, and reassurance must be given. Even late reaction rashes are known. You can just give the confidence if you have them. These are this one tablet for this can be given, and they can take those. So this is a very important
Yes.
reassurance to our healthcare providers, because they are used to giving iron sucrose, and this is no different from that. So that message I want to give. And number one, as you mentioned, so you can first further tell me, and what all conclusion remarks I can give, I will tell you.
Yeah.
Before that, you
As
can.
you rightly said, Dr. Bellat, I think if we train our nurse staff and we have the correct protocol, because in our practice, in my practice also, I always have this emergency tray. We have charts put up in that room where we give intravenous iron. We do not give the intravenous iron in the general wards. I see that that lady is brought down to the ward to the room where the trained staff are there, who will only administer the intravenous iron. That is the time frame of 5 to 6 minutes. If it's 500 milligrams, 10 to 15 minutes in 250 ml. If it is 1000 milligrams, monitor the vitals, sit with the woman, give her the transfusion. The emergency drugs are available post transfusion. Keep
This
her
all
there.
is there in that video.
Yes, sir. So this,
And
if we practice this, as you said, where there are very very minimal side effects, the women are
safe
very confident.
IV infusion can be given.
Yes,
I
yes.
must also thank Dr. Sunita here. She has brought up that book is not released. Probably she
Not
might release in January.
ASUG.
The anemia booklet. There are
Yes.
12 authors. We have also contributed one of that. So I think that may be a good move by to educate the obstetricians by Dr. Sunita Tandulwadkar on this. I must thank her for that, because
Yeah.
that anemia book is going to make a big difference.
Yes. So,
So
Dr. Bella, it has been an excellent podcast that we have had. So, we have just a few minutes, and of course, I want you to give us 3 to 5 points which should be practiced by each one of us in our clinical practice, so that we can aim towards an anemia mukta Bharat, which is going to give us a future progeny who are going to be shining like stars in the galaxy.
thank you very much, and it was same here. You have been wonderful in this podcast, and I hope I have been able to meet whatever the expectations. But the messages I want to give is: number one, treat the woman before she is pregnant. Evaluate her, just not iron deficiency. See, evaluate her anemia, whether she is a hemoglobinopathy patient or vitamin B12, folic acid, supplement, and she is not hypothyroid, she is not diabetic. This is an important message, number one. Then see that she is not deficient or store deficient. And please understand, iron deficiency anemia is a severe spectrum of iron deficiency. So don't treat anemia, treat iron deficiency. If your baby has to get optimal iron storage, because breast milk does not have iron. So baby must be nicely supplemented with a good storage when it is born. The third factor is, if if at 30 to 32 weeks, please check not only anemia, also look for iron levels. supplement with the IV iron at that point, because that is the one which is going to go into the babies. And the government of India has brought up 1,000 days concept based on this,
Yes, the
because
1,000.
the fetal and the infant growth happens in these, specifically with reference to brain. So 280 days of pregnancy or 270 days of pregnancy and 2 years
2
after that.
years. First
So it
1,000
is
days.
365 is again 730
Yes.
there. So
Plus 2.
this adds to 1,000 days. During this time, we should see that we want to break this cycle, that our women, our generation, our country women and babies are no less than anywhere else in the world. And our babies also will be like, you look at 3.5 kg baby of a European or American baby, it is more rich in muscle mass, not
Yes.
fat mass. And
True.
see, if our woman is not anemic or store deficient, she's not store deficient, the baby will get optimal growth and development of all the system, especially skeletal system. So that is one. And the last message is, if we want our next generation to be smarter and intelligent,
Yes.
their mothers should not be anemic or iron deficient.
Even before they conceive.
They
They should
before
be
they
now.
become pregnant.
Because
And
those first few days, the few weeks are very, very important.
yes, that is why the healthy concept has to happen. This is very essential.
Yes.
And also treat their partners so that they are not anemic, and avoidance of certain drug abuses by women like tobacco chewing, alcoholism, all that should be also stopped during pregnancy, to see that our women are not anemic, our babies are no less than anyone else in the world. Thank you so much for this
Thank you.
opportunity.
Thank you, Dr. Bellad. And I thank Dr. Sunita for giving us this opportunity. As you very well have summarized the whole podcast, let us nurture the future so that our children are brought into this world with good health so that India shines much, much better. Thank you very much, Dr.
Thank you.
Bellad.
Thank you
And
so
I
much.
also thank the technical team and the Gyan Pravaha series organizers for giving us this opportunity. Namaste.
Thank you so much. Thank you.
Namaste.
And we want to invite you for one message is Karnataka State Maternal Anemia Convening is going to happen shortly in January.
Sure, sir. Thank you. Thank you, Dr. Bellad. Thank you very much.